Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nashaba, a certified medical coder. In this video, we will cover some important practice questions from the remaining radiology topic along with guidelines and quick elimination methods so you can choose the correct option within a minute. So without further ado, let's get started. A patient with colon cancer receives 7 radiation treatments. During the course of the treatment, the physician views the port film, reviews the treatment parameter, and assesses the patient response to the treatment. Code for the radiation treatment management. Option A with code 77,427. Option B with code 77,427 into 4. Option C with code 77,427 into 2. Option D with code 77,427, 77,435. In this scenario, a patient with colon cancer receives 7 radiation treatments. For radiation treatment management, code 77427 is used, which is for managing radiation treatment with 5 fractions. The key point with this code is determining how many units are used when there are remaining fraction after the first 5 has been counted. According to the coding guidelines, 1 or 2 fractions beyond the multiple of 5 at the end of the course treatment should not be reported separately. However, if there are 3 or 4 fractions beyond a multiple of 5, code 77,427 should be reported to account for those additional fractions. For example, with 7 units, as mentioned in this scenario, there are 2 fractions beyond the multiple of 5, so these should not be recorded separately. But if there are 8 units and 3 fractions beyond a multiple of 5, code 77,427 should be reported separately for those additional fractions. Based on this guideline, we can eliminate option B with 4 units and option C with 2 units of code 77,427. Option D is also incorrect. It is uses code 77,435, which is used for stereotactic radiation therapy treatment management. We can't use this code with code 77,427 as mentioned in the parenthetical note below code 77,435. Therefore, the correct option is option A with code 77,427. Hannah came for her annual screening mammogram, which revealed a mass in her left breast. After reading screening mammogram, doctor scheduled for computer-aided detection screen mammography to view film study of left breast. What CPT code should be reported for this procedure? Option A with code 77,066, option B with code 77,065 along with modifier 50, option C with code 77,067, option D with code 77,067 along with modifier 52. In this scenario, a screening mammography is performed. Based on the type of the mammography is performed, we first eliminate option A and B. A scores in both options are used for diagnostic mammography. In remaining two options, code 77067 is used for screening mammography, specifically for bilateral procedure. Since the procedure involves only the left breast, which means a reduced service is performed, we need to use the code 77067 with modifier 52 to indicate a reduced service. Therefore, based on the modifier used, the correct option is option D with code 77067 along with modifier 52. A physician manages radiation therapy treatments for a patient with small cell lung cancer who is receiving 18 MeV external beam application with 1 port and 2 blocks. Which CPT code is reported for the radiation therapy services? Option A with code 77402, option B with code 77412, option C with code 77385, option D with code 77401. In this scenario, radiation therapy treatment is performed for a patient with small cell lung cancer. For radiation therapy treatments, codes are based on the terms simple, intermediate, and complex. However, in the question, instead of these three terms, area, port, and blocks are mentioned. When coding for radiation treatment, you need to know the number of treatment areas, the number of ports and blocks. The detail of terms simple, intermediate, and complex are provided in the paragraph about these codes. In this scenario, there is one treatment area lung with one port and two blocks means simple radiation therapy treatments are performed as mentioned in option A with code 77402. Option B is incorrect because it is based on complex radiation therapy treatment. We eliminate option C because code 77385 is intended for high intensity radiation doses used to treat cancer of breast and prostate cancer. This is not applicable for the giving treatment of small cell lung cancer in this context. Option D is also incorrect because code 77401 is used for radiation treatment using superficial or ortho voltage, a very low energy level radiation that does not penetrate very deeply into the body. A patient was involved in a motor vehicle accident and his face struck the steering wheel. He sustained multiple contusions and facial swelling. The physician suspected a zygomatic malar or medullary fracture. The radiologist performed an oblique anterior-posterior projection which clearly showed the facial complex. An anterior-posterior and lateral view was also taken. What CPT code should be reported? Option A with code 70,150, option B with code 70,140, option C with code 70,110, option D with code 70,130. In this scenario, the radiologist took three views of the patient's facial bone. To determine the correct code, we need to analyze each option based on the area being imaged and the number of the views taken. We eliminate option C with code 70,110, which is specifically used for the imaging of the mandible, which is a jawbone, and option D with code 70,120 describe three views of the mastoid, a bone located near the temporal bone, not the facial bone. In the remaining two options, as both options contain the codes used for the facial bone, now we choose the correct code based on the number of the views. Since the scenario involves three views of the facial bone, the correct option is option A with code 70,150, which accurately describe three views taken of unspecified facial bone. A 30-year-old driver lost control of her car and crashed into a light pole on the highway. She arrived to the hospital. She had CT scans without contrast of the brain and chest. She had X-ray of anterior posterior and posterior anterior views of her left rib and anterior posterior and posterior anterior views of her right ribs with posterior anterior view of the chest. The CT scan of the brain showed a fracture of the skull base with no hemorrhage of the brain. The CT scan of the lung showed no puncture of the lungs. The X-ray showed fracture in the right and left, second and third and fifth ribs. What CPT and ICD tensium codes are reported? Option A with code 70,450 along with modified 26, 71,250 along with modified 26, 71,101 along with modified 26, S02.109A, S22.43XA, V47.32XA, Y92.411. Option B with code 70,460 along with modified 26, 71,260 along with modified 26, 71,110 along with modified 26, S02.01XA, S22.49XB, V47.0XXA, Y92.411. Option C with code 70,450 along with modified 26, 71,250 along with modified 26, 71,111 along with modified 26, 71,045 along with modified 26, S01.109 A, S22.49XA, V47.32XA, Y92.411. Option D with code 7450 along with modified 26, 71,250 along with modified 26, 71,111 along with modified 26, S02.109A, S22.43XA, V47.5XXA, Y92.411. In this scenario, CT scan of the brain and chest was performed without contrast. We first eliminate option B with code 7460 used for CT scan of the head or brain with contrast material. In option A, C, and D, code 7450 is used for computer tomography, head or brain without contrast material, and code 71250 is used for computer tomography, thorax or chest diagnostic without contrast material. Now we need to focus on the third code in each option, which relates to the radiologic examination of the ribs. As the scenario involved the radiologic examination of both ribs, we also eliminate option A with code 71101 used for unilateral radiologic examination of the ribs. In both remaining options C and D, code 71111 is used for radiologic examination of ribs bilateral including posterior anterior chest minimum of 4 views. We eliminate option C with code 71045 as this code is used for radiologic examination of chest. Since the chest is already covered by the code 71111, this separate coding procedure is not needed in this case. So for this scenario, our correct option is option D. A patient with hydronephrosis has left nephrostomy and has agreed to a pyelography IVP to rule out a right renal obstruction. The patient was placed prone on the X-ray table 1 hour after IV infusion of contrast. Contrast flowed from the left and the right renal pelvis down to ureters into the bladder where the Foley catheter was positioned. The IVP showed no obstruction or abnormalities in the urinary tract aside from the left hydronephrosis of the pelvis. The right kidney and ureter showed no obstruction. Bladder appeared within normal limits, but CPT code is reported for the radiological services. Option A with code 74415 along with modified 26. Option B with code 74400 along with modified 26. Option C with code 74425 along with modified 26. Option D with code 74420 along with modified 26. In this scenario, pylography is performed, which involves the injection of contrast material into the vein. Based on the technique used to perform the procedure, the correct option is option B with code 74400, which correspond to urography, pylography, intravenous, with or without QB, with or without tomography. Option A is incorrect because code 74415 is used for urography using drip and or bolus technique. Option C and D are incorrect because code 74420 and 74425 are used for the procedure where contrast is directly injected into the ureters via catheter to visualize the lower urinary tract. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.